Shoulder replacement surgery is an opportunity for us to eliminate pain in an individual that's suffering from pain from an arthritic joint. So for those patients that have substantial or end-stage arthritis of the shoulder, those patients may be candidates for shoulder replacement. However, not everybody that has shoulder arthritis needs surgery. We oftentimes use non-surgical modalities such as anti-inflammatories, rest, and cortisone injections. If they fail conservative care, we oftentimes will have a surgical discussion about shoulder replacement surgery for patients with arthritic shoulder. Depending on which type of problem you have, either substantial arthritis with an intact rotator cuff or arthritis with an irreparable rotator cuff, that leads to the decision-making process in determining if someone will require either a total shoulder replacement or a reverse total shoulder replacement. Total shoulder replacements are best for patients that have substantial or end-stage arthritis in lieu of a normal functional rotator cuff. Essentially what a patient has done is they have a new ball and a new socket placed where the old ball and socket was arthritic or degenerative. A reverse shoulder replacement, on the other hand, is best for individuals with an either irreparable rotator cuff or a torn rotator cuff in the setting of bad arthritis. In this particular procedure, the ball and the socket is also resurfaced, but in a different fashion. We take the ball and we fix it on the socket, and the humerus becomes concave, and that humerus bone will rotate around the fixed socket. And both tend to work well for the appropriately selected patients. Before the surgery, our job is to give patients the adequate and appropriate amount of information to understand exactly what's going to happen that day. So the pre-admission testing team is an excellent support staff that we are fortunate to have at Northwestern.
Once we've received notification from the surgeon's office, we contact the patient to set up any testing that needs to be done. This would include things like chest x-rays, lab work, and EKGs.
The preoperative testing department will go over things and discuss the procedure, what to expect, and to answer any questions.
The patient is called the night before to be notified what time their surgery is and what time they need to arrive at the hospital.
Patients having shoulder surgery will need to wear something loose, preferably button-up, that is easy to put on after surgery.
On the day of the surgery, the patient checks in at the front counter and meets the staff there to get their paperwork ready for the operation.
The patient will be seen by the surgeon who will be performing the surgery.
At that time, we'll discuss the procedure, as well as confirm that the informed consent form that the patient will sign matches with the correct extremity. After this, the anesthesiologist will discuss at length with the patient choices and options for anesthesia.
Typically for shoulder surgery, there are two types of anesthetics a patient will receive. The first component is a general anesthetic that the patient receives in the operating room, and the second component of the anesthetic is a nerve block. A nerve block is an injection of numbing solution to help render an area of the body numb.
Nerve block serves two purposes. First, it can control pain before and after the operation. It usually allows patients to go home feeling limited to no pain because the anesthetic works for approximately 12 to 18 hours. The second benefit is the less pain the patient is experiencing during the operation requires less general anesthesia. So when patients wake up from the operation, they oftentimes go home not feeling nauseated.
Nerve blocks are safe, which is why it's a routine component of our anesthetics for patients undergoing shoulder surgery.
In the operating room, usually there are 3 or 4 people. First, there's the anesthesiologist. Second, there's myself and oftentimes my physician assistant. There will be a scrub nurse whose job is to pass instruments to myself and my physician assistant during the operation. For shoulder replacement surgery, the incision is approximately 2 to 3 inches. Once the surgery is complete, we'll close the wound delicately with a bioabsorbable suture and place a dressing that is waterproof on the area that will allow patients to shower that night or the next day. Patients wake up in the operating room. A lot of times because of the anesthetic, they won't remember that, but a patient is transported from the surgical suite to the recovery room, at which time a surgical postoperative nurse will take care of them. As shoulder replacement surgery is becoming less and less invasive, we are pushing the envelope more and more in a safe manner to get patients home.
Total shoulder patients can expect to go home the same day of surgery or be discharged the day after. Shoulder patients will be restricted to one arm after surgery for a while, so may need help with chores and food preparation immediately after surgery.
It's important to get things set up at home. It's important to have family members help if possible. Thinking about these things before the operation will typically make the surgical experience a lot better.
After surgery, patients can return to driving once they are off of pain medications and they feel safe to drive. They just need to remove their sling.
We'll utilize a sling for about a month. This allows the wound to heal and allow the muscles to function again. Patients will come into the office approximately 2 weeks after the operation for their first postoperative visit, and then we begin formal physical therapy.
The goal for physical therapy for the shoulder procedure is really to just begin with gentle range of motion. Once we progress beyond that, we can start doing some gentle strengthening as well. Once we get to there, we can go on to the returning to prior level of function stage, where we really go a little bit more aggressive strengthening and get them back to feeling like they were prior to surgery. Home exercises for the patient is one of the more important aspects of recovery. My advice for the home exercise is to try to really get into a routine.
Individuals should expect their shoulder to be pain-free and very functional. A range of motion will improve after the surgery. In general, an individual should regain approximately 50 to 80% of their range of motion loss after the operation. After 4 to 6 months, we expect individuals to get back to their normal life in a pain-free environment. We will guide that person through the steps to return to normal functionality. We are on the cutting edge and the forefront of orthoscopic and joint replacement surgery at Northwestern. When you come to Northwestern, you should feel comfortable in the fact that you're receiving the most innovative, cutting-edge procedure that is available.